Welcome back, everyone. It's a big day in Pennsylvania as vaccine eligibility expands to all residents 16 and older.
And joining us now live this morning is Dr. Rob Danoff of Jefferson Health. Good to see you as always, Dr. Rob.
Hi, good morning. Good to be here.
Good morning. So this expanded eligibility, we knew it was coming a little bit ahead of initially what it was anticipated to come. And then there's also this good news. We talked about this, a possibility of a vaccine becoming an option for kids with that Pfizer request for emergency use authorization. So how could this help in terms of curbing the spread of the virus?
You know, you raise great points. This is huge. You know, 20% of our population in the country is less than the age of the current vaccines approval. So getting the vaccines approved for younger age is huge. We will never reach herd immunity until we get to vaccinate the kids. And now, with Pfizer having applied for 12 to 15-year-olds, that's a big application. Hopefully in the next few weeks, they'll get emergency use authorization. So as long as we can start vaccinating the younger kids, that's going to move us more towards normalcy in our country and herd immunity. And now Pfizer last month started vaccination initiative on 6 months of age and older in a study. So far it's over 2,200 kids have been enrolled in it, and they're going to keep on enrolling. There's 11 sites in our country to see how that's going. Moderna also is doing that. The big goal is to hopefully get kids going to middle school and high school, especially high school, vaccinated before school. And then the younger kids, hopefully early next year. So they're really working towards that.
So, Dr. Rob, despite the vaccinations, new cases continue to rise in our area. Is this a cause for concern with these spikes?
Yeah, Jim, it's huge. You know, the majority of cases now are in 20 to 39-year-olds. And that's, you know, this is a group that has not been immunized unless they had significant medical conditions. Pennsylvania is the 6th highest rate in the country of new cases. The same thing with New Jersey. Now, you might read death rates have gone down, which is true, because the older you are, the more at risk you are for death. But our cases are getting higher. We're concerned that it's going to continue to go because a lot of people now are just not socially distancing, not wearing masks. So everyone out there, we still need to keep wearing the face coverings. It's so important. Until we get more people immunized, we need to continue to do these social distancing, face coverings, washing hands.
All right, and Dr. Rob, since the beginning, a huge concern with this vaccination rollout has been the supply. So now that more people are eligible, are you concerned about getting enough doses to keep up with the demand?
You know, that is a concern. You know, we've heard about Johnson & Johnson decreasing doses, not quite sure why right now. However, we do have good Pfizer and Moderna vaccines available. Yes, they are 2 immunizations, you know, spaced apart, but they work so well. It seems now that we are getting a more consistent supply each and every week. You know, we had over 4 million doses applied yesterday or 2 days ago in the country. You know, Pennsylvania is doing now a lot better job about getting these vaccines out, and we're told we're going to continue to get a regular, reliable supply. This is good news. Now that it's open to everyone 16 and above for Pfizer, Moderna is 18 and above. Please, you know, register at different sites, and as soon as you have the option, please consider getting this immunization. It could be life-saving, not only to you, but to your loved ones.
So, Dr. Rob, you know, we've been seeing reports of vaccinated people then contracting the virus. So how common is this, and can they still spread the virus?
Yeah.
Great points. Yes, you know, the vaccines are not, you know, what a lot of people don't realize is you can be fully vaccinated, but still get the infection. Okay, but the way the vaccines work is they prevent illness or serious illness, and that's what you want. If we can prevent death and serious illness, that's an effective vaccine. Now, Jim, you raise a good point. You know, you can get the infection even if you're fully vaccinated. The question is, do you have enough infection in you to give to other people who are not vaccinated? So we're not sure yet. That's why they say when you go out, even if you're fully vaccinated, wear a facial covering. Studies are ongoing. They're very promising that if you do have the virus and you're fully vaccinated, that you may have a lower virus level and you may not transmit it to others, but we're still not sure. That's why please continue to wear facial coverings. We know they work.
Well, Dr. Rob, a lot of people in our area are snowbirds. They headed south for the winter. They're now coming back after Easter to come up here for the summertime. They received their first shot down, say, in Florida or down south. How can they get a second dose if they're now back home?
You know, again, this is so important. Now sites are starting to open up to people who have been vaccinated in other areas. It was a huge barrier before. We're saying people go back to where you got it. Now more sites are open to it. I know our sites are doing that. The whole goal is, no matter where you're vaccinated the first time, we need to get you vaccinated for your second shot. So check with the place that you register with. More are having vaccines available to do that to help you. So Jim, you raise a great point. Check with the location you're going to.
I have to say, Dr. Rob, it is such a relief to be able to register for these vaccines. People are just eager to spend time with their friends and family again, and this is one step in the right direction. So
it's huge.
Yeah.
It's huge. People get really emotional. They cry. They say, I can be with my kids or grandkids, my loved ones, my friends. This is going to help us return to a new normal, but we're social human beings. This is so important. Please consider it. Speak with your healthcare provider and get that vaccine.
Great advice.
Absolutely.
Thank you, Dr. Rob, as always.
We'll see you soon. Thank you.